I recommend the following strategies for preventing chronic Lyme disease. Chronic Lyme disease, characterized by persistent symptoms that can linger for months or even years, is a growing concern for both patients and healthcare providers. Traditionally, Lyme disease has been seen as a straightforward infection, diagnosed early, treated with antibiotics, and has resolved. However, for a significant number of people, Lyme disease can evolve into a chronic condition marked by ongoing fatigue, pain, and cognitive issues. But what if much of this chronic suffering could be prevented? Recent insights suggested that the progression to chronic Lyme disease might be mitigated or even prevented by focusing on several key factors. This approach is similar to how we prevent other chronic diseases like type 2 diabetes or heart disease, through early detection and appropriate treatment. First, the importance of early diagnosis and treatment. One of the most critical steps in preventing chronic Lyme disease is the early diagnosis and treatment of the infection. When a patient presents with a tick bite or early symptoms of Lyme disease, such as the characteristic erythema migrans rash, it's vital to begin treatment promptly. Early intervention with antibiotics like doxycycline can significantly reduce the risk of infection progressing to a chronic stage. Moreover, it's essential to maintain a vigilant follow-up process. Even after initial treatment, patients should be asked to return for evaluation if symptoms persist or recur. Lyme disease can sometimes be insidious, with symptoms reappearing after what seems like successful treatment. Regular follow-ups allow healthcare providers to monitor the patient's progress and catch any signs of relapse early. Second, look for co-infections. Co-infections are another critical factor in the progression of Lyme disease in a chronic condition. Ticks often carry more than just Borrelia burgdorferi, the bacterium responsible for Lyme disease. They can also transmit other pathogens like Babesia, Bartonella, and Anaplasmosis. These co-infections can complicate the clinical picture and may require different treatments. It's important to test for and consider co-infections, especially if a patient's symptoms do not resolve with standard antibiotic therapy. Addressing all possible infections early on can prevent the persistence and worsening of symptoms. Number 3, consider retreatment. In cases where initial treatment does not fully resolve the symptoms, it may be necessary to consider retreatment. Clinical judgment plays a crucial role here. While some cases of Lyme disease respond well to the standard courses of antibiotics, others may require a more prolonged or alternative treatment approach. Retreatment should be considered for patients who continue to experience significant symptoms, particularly if they show signs of ongoing infection or co-infections. Number 3, follow-up care is crucial. Consistent follow-up care is essential in managing Lyme disease and preventing its progression to a chronic state. Even after symptoms appear to have resolved, patients should be monitored for any signs of recurrence or new symptoms. Chronic Lyme disease can sometimes develop months or even years after the initial infection, making long-term follow-up a key component of care. Number 4, environmental awareness and preventive measures. Preventing Lyme disease, and by its extension, chronic Lyme disease, starts with avoiding tick bites in the first place. Environmental awareness is crucial. Patients should be educated about the importance of using insect repellents, wearing protective clothing, and performing regular tick checks after spending time outdoors. Simple preventative measures can significantly reduce the risk of contracting Lyme disease. 5, raising awareness and improving access to care. Public awareness and education are vital in the fight against chronic Lyme disease. Many people are still unaware of the risk associated with tick bites or the early signs of Lyme disease. Educating the public about the importance of prompt medical attention after a tick bite and need for comprehensive care can help reduce the number of cases that progress to chronic illness. Additionally, improving access to knowledgeable healthcare providers who are familiar with the complexities of Lyme disease is crucial for early diagnosis and effective treatments. By focusing on these key factors, early diagnosis and treatment, vigilance for co-infections, consider retreatment when necessary, and providing consistent follow-up care, we can significantly reduce the risk of Lyme disease progressing to a chronic condition. This proactive approach offers hope for better outcomes and improved quality of life for those at risk of chronic Lyme disease.